Welcome to this session on supporting social care research. I'm Chris Speed, Deputy Chief Operating Officer for the Clinical Research Network North East and North Cumbria, and I'm delighted to be joined by my colleague Kim Shirley, our Research Operations Manager with responsibility for social care research. From the 1st of January 2019, the Clinical Research Network support was extended to include public health research studies and social care research studies, those that came out of the NIHR's School for Social Care Research or that were funded through the Research for Patient Benefit Social Care Call. The expansion project also included other studies that were taking place outside of NHS settings, for example, palliative care studies. This expansion into near and non-NHS settings was very important for the NIHR. Shortfalls in social care provision puts pressure on finite NHS services. High quality social care research can improve the quality of people's lives and the sustainability of the NHS. The two are linked, and in this project we're joining the dots. Increasing the volume and impact of social care research is a priority for the NIHR to enable it to create an evidence base for social care policy and social care practice. Now, the Clinical Research Network has less experience around recruitment of participants from social care settings. To deliver research that is of benefit to social care practice will require the Clinical Research Network to develop an increased understanding of social care research and to make an offer that is relevant to the social care research community. The Clinical Research Network needs to understand what social care is and how research in social care settings differs from those NHS settings and what opportunities there are that we might develop. The expansion project is something that we have taken very seriously locally. Our new clinical director is very keen that we engage with near and non-NHS research. We set up a task and finish group made up of active researchers in the region, members of the ARC and representatives from local authorities. We've invested in regional leadership, and I'm delighted that Dr. Ruth McGovern has been appointed as our regional lead for social care research. We've made an investment into an innovative internship scheme, which allows us to engage directly with members of staff in local authorities and to buy out their time to enable them to work with us to develop their research skills and to act as advocates for social care research in their local authorities. And with the ARC, we have co-invested in a scheme of an embedded researcher and a native researcher. We also have protected project manager time to really enable us to understand exactly what it is that our social care research community needs from the Clinical Research Network to support it, to deliver its research and to recruit to time and target. And at this point, I'm going to hand over to my colleague, Kim Shirley, and she will talk about our study support service and the offering that we make to our social care practitioners and researchers.
Hello, my name is Kim Shirley and I am a Research Operations Manager at the Clinical Research Network North East and North Cumbria. The main element of my role is to support chief investigators within the North East and North Cumbria region to deliver NIHR portfolio research. The aim of this short presentation is to talk through the services we can provide to investigators delivering NIHR portfolio research in social care settings. The NIHR Clinical Research Portfolio of Studies consists of research projects that are eligible for support from within the CRN in England. In order to be included on the NIHR portfolio, certain criteria need to be met. The three main elements of this are that the project has a clear research question that aims to derive generalizable new knowledge, that the funding has been secured through open competition, and that the study has been peer-reviewed. Any study that receives funding through a Research for Patient Benefit Award would meet this criteria and be automatically eligible for inclusion on the NIHR portfolio. There are a number of benefits to be included on the NIHR portfolio. The study support service is something that CIs can access to support the successful delivery of their project. We will look at the elements of this in the following slides. NHS support could potentially include staff being available to support the delivery of your project, or it could entail providing service support costs to organisations involved. The details of this support is dependent on a number of factors and will be discussed on a study-by-study basis. The CRN offers a wide range of research-specific training, for example, good clinical practice or research consent training, and inclusion on the NIHR portfolio allows you to access this free of charge. With the Clinical Research Network, we have a number of teams who can help support your project, for example, through links to PPIE groups or communication support in advertising your study to improve engagement with potential participants. The first element of the study support service is early contact and engagement, and this will consist of an initial conversation with one of our research operations managers to discuss your project in detail and assess what support you may need from the CRN to successfully deliver your project. We would go through the requirements of portfolio adoption and the most appropriate route for applying, which will depend on where your study is taking place. As part of your research approvals, all elements need to be costed following the Department of Health and Social Care attributing the costs of health and social care guidelines, and the CRN can provide advice and support on how to do that. Following this initial meeting, we will also put you in contact with our partners who may also be able to provide support, for example, the Research Design Service or a clinical trials unit if appropriate. You may have already identified the organisations you would like to be involved in your project, or this may be something you would like help with. As part of the study support service, we can help to identify suitable sites who would like to be involved in your project. We work with organisations in a variety of settings, including local authorities, care homes, hospices, schools, as well as the NHS. And we can put you in contact with sites who have research experience and can support you to reach the participant groups you would like to engage with. Not only can we do this locally, but we can also work with our national colleagues to identify suitable sites outside of the North East and North Cumbria region. Once you have identified the organisations you would like to involve in your study, you can access study coordinators within the Clinical Research Network who can work with you to make sure that all sites have the necessary approvals in place in order to open the study to recruitment at that site. The final element of the study support service is performance monitoring. During the recruitment phase of your project, we will work closely with you to ensure that you are on target to recruit the required number of participants to answer your research questions. If there are any issues with your recruitment, then we would provide guidance and support in conjunction with your study sponsor to ensure that you'll meet your recruitment goals within your study timelines. Thank you for your time today, and if you have any questions or would like to discuss a new project, please do not hesitate to contact us via this email address. We look forward to hearing from you.
Thank you, Kim. These really are early days and we're learning as we go. We're developing a greater insight into the local pipeline of studies and the topics of research interest in the region. We're looking at best ways to fund and support the research community going forwards, and we're very happy to take on board suggestions that you might have as to better ways in which we can support you and better ways in which we can work with you. And please feel free to get in contact with us at any time using the email address below. So on behalf of Kim and myself, I'd say thank you for your time and your attention today, and we look forward to catching up and engaging